infection. Is an infection is the cause of the B bacterium Chlamydia Trachomatis is a gram-negative the bacterium that infected the columnar epithelium of the cervix, urethra, and rectum. Has the will that has no genital disease shown as the lung and edges. It is the most commonly the transmission through sexual contact. Most people that with chlamydia have no symptoms.
Chlamydia is a sexually transmitted infection caused by the bacterium Chlamydia Trachomatis. It is the most common bacterial STI, mainly affects young people 15 to 24 years of age, and is more common among women. Between 1997 and 2011, the number of infected people nearly tripled. The people most at risk of chlamydia are those who have multiple sex partners, those who practice unsafe sex, and those who have a history of other STIs. In men, symptoms can include a discharge from the penis, pain while urinating, along with tender or swollen testicles. The symptoms resemble those of gonorrhea. They can appear intermittently or disappear completely while the person remains infected. In women, symptoms include an abnormal vaginal discharge, bleeding between menstrual periods, or after sexual intercourse. In both men and women, chlamydia can cause rectal itching or bleeding, as well as anal discharge and diarrhea. However, chlamydial infections are asymptomatic most of the time. To diagnose chlamydia, a test is required. For women, screening involves a cervical exam with a swab sample. A urine test can also suffice. For men, a urine test is now equally effective and less painful than the traditional urethral swab. Chlamydia is easily treated with antibiotics. You need to take the full course of medication and refrain from sexual relations, oral sex included, until the treatment is complete. After symptoms disappear, the infection can linger in the body and still be contagious. To break the chain of infection and to avoid being reinfected, you need to alert all your sexual partners within the previous 60 days and encourage them to get screened and treated if necessary. Your doctor can assist you in using our anonymous partner notification service. Some effective ways to prevent chlamydia are practicing safe sex by always using condom, avoiding sexual relations under the influence of drugs or alcohol, and limiting your numbers of sexual partners. You also need to get screened regularly for STIs. Your sexual health is important to us and to you, so have fun, but be safe.
Application in the nursing explaining the obvious about the sexual intercourse during active infection to the project department, about the sexual intercourse during the treatment, to the about use of the condom and not have the many sexual partner, indication that the you must watch the virgin and undercross the separate.
I'm Bahira Giyushi. I'm fertility lead for East Kent Hospitals, and I deal with all the fertility issues that come to our trust. I see a number of young girls and women coming to my fertility clinic that have been unknowingly exposed to chlamydia and then come back with fertility problems. Chlamydia usually goes to the cells of the tubes and causes damage in the tubes, which they can either block the tubes or damage the proper function of the tubes. And the problem with chlamydia that most of the women who have it don't know that they have it. And when they do approach us, it's then a bit too late because the damage has already been done. Although it has an effect on the tubes, that if it's picked up early and treated early, we actually stop the damage in its tracks completely. The important thing to remember is chlamydia doesn't have many symptoms in the majority of cases. So if you're having unprotected sex, even in a faithful relationship, then go and get tested. These tests are for free for under 25. If you've got any suspicion or you feel you're at risk, then for your own peace of mind from this silent threat to your fertility, go and get a test for chlamydia.
Pros. When you are diagnosed with chlamydia infection, the most viable treatment you will have is with antibiotics. They often work faster and reduce the symptoms immediately. Cause. In the woman there and the complication of the greater degree of the severity and the possibility of having the circulate. Vertical spread the causing endometritis. The salpingitis the causing inflammation of the fallopian the top, like the causing ectopic the pregnancy in the fertility. Using application in the Ecuador. It's more in the common in the women of the reproduction again, according to who the privilege in the adolescent again the 15 to 19 years. Risk the factor for infection included again under the 25 multiple sexual partner. Usually the 70% of the women with chlamydia do not have any symptoms.
In the United States in 2011, the rate of Chlamydia Trachomatis, a sexually transmitted infection, was 3,416.5 per 100,000 women ages 15 through 19, which showed a 3.5% increase from 2010. Although chlamydia is treatable, 80% of women with the infection, including pregnant women, are asymptomatic, leading to lack of diagnosis and treatment, ultimately putting them at risk for adverse birth outcomes, including ectopic pregnancy, preterm birth, and passing the infection on to a child during birth. Today, I am presenting a study that's purpose was to determine the prevalence of Chlamydia trachomatis in pregnant women and to see if there was an association between chlamydia infection and risk factors such as low birth weight babies and preterm births. The study conducted was a population-based prospective cohort study in the Netherlands, and urine samples were collected from 4,055 pregnant women from age ranges from less than 21 to greater than 30 years of age. Of the 4,500 samples, Chlamydia trachomatis was found in 157 of those cases, with the highest prevalence in the women less than 20 years old. Also, 190 women experienced preterm delivery between 32 and 35 weeks of gestation, which was significantly associated with the infection. From the findings in the study, it's evident that Chlamydia trachomatis is widespread in adolescents under the age of 20. Therefore, adolescent healthcare providers may want to place larger emphasis on this rapidly growing infection. The combination of screening and prevention methods may help to lower the spread of infection, and treatment is available once diagnosed.
Conclusion. Chlamydia infection might result in the pelvic inflammatory disease, infertility, and ectopic the pregnancy. Chlamydia screening is the recommended in the sexually active, the woman that you heard than 25 years of age, and other women at increase the risk and can be performed on the vaginal swab or urine sample.
The test for chlamydia involves a urine-based test where the patient would urinate in the cup and the specimen is sent to a lab and tested for chlamydia, and the results come back within 3 days. Chlamydia is easily treated with a low-cost antibiotic that cures the disease and kills the organism when you take it. Some of the complications of chlamydia, if it goes untreated in women, it can lead to infertility, as well as it can lead to pelvic inflammatory disease. In men, if it goes untreated, it can lead to pain in the testes, and those are some of the more common complications that can occur in both women and men. If you're going to have sex, then you need to use protection, but to be completely free of chlamydia is not to have sex. Those people who should be tested for chlamydia include women who are sexually active under the age of 25 should receive an annual test for chlamydia, and then those women who are sexually active who are over the age of 25 and have risk factors for chlamydia, which include multiple sexual partners and unprotected sex. Those men who should get tested include, of course, if they have symptoms like a discharge, and if they and consider getting the test annual if they're sexually active without symptoms.